Blood is one of the essentials that make a human being function normal, and for years doctors and other medical personnel in public health facilities have to perform procedures that include blood transfusion. However, there are speculations of some wrong medics charging patients for blood, which is against medical ethics in Uganda. Also, this leaves the lives of many vulnerable Ugandans at risk, as only the well-to-do can access blood. During a media press conference at Uganda Media Center in Kampala, the Executive Director, Uganda Blood Bank Services, Dr. Dorothy Cheyune, sounded a warning to all medical officers involved in selling blood and reminded them no one is supposed to charge blood in the hospital since it's collected from the natives at no cost. She said this is an offense and requested patients to report these complaints immediately.
We collect this blood free from voluntary blood donors, and the policy of government is that all medical services are free, including the blood that is issued. This blood must be given free by both government and private healthcare facilities. What we understand in private healthcare facilities is that many times the charges are towards the blood cross-match and the blood transfusion set, which is used to administer blood.
Dr. Dorothy blamed the patients for not reporting the doctors, forcing them to pay the blood, saying the ministry has commenced investigations into the matter.
There are other times when we have witnessed when blood is sold by healthcare providers, and this has even got the attention of His Excellency the President. We have started investigations. We have started ways of improving, and this is going to happen in this Congress.
The Deputy Principal of the School of Health Sciences at Makerere University and also a specialist in blood transfusion, Professor Isaac Kaja, urged Ugandans to take time in understanding their blood group, saying it is dangerous for one to take blood which is not composed for their particular blood group.
When you do not get your own blood grouped blood, when you get a unit of blood which is not of your group, you are bound to have terrible, sometimes fatal reactions. That is why it is extremely important to first and foremost identify your group, but also identify a blood product which is properly typed.
Professor Kaja added that they have initiated strategies for limiting the cost of overuse of blood which is collected from the field. He, however, asked every Ugandan to take part in donating blood so as to increase the collections.
If we did a good mother-child health care, good programs, we put them in place, and their aim is geared towards preventing these conditions that are going to cause a lot of blood loss for the mothers and a lot of anemia for the children, secondary to malaria and the hookworm infestations, then we shall have solved that problem.
On the other hand, Dr. Charles Olaro, the Director Clinical Services at the Ministry of Health, advised people to seek medication for diseases like malaria as early as possible and normalize sleeping under treated mosquito nets in order to beat blood shortages. He said that malaria is one of the diseases that requires a lot of blood and yet can be prevented.
Sleeping under the mosquito net, early diagnosis, and then treatment. And that's why we are rolling the test and treat. Specifically for mothers, we encourage that you attend antenatal. Because antenatal, you definitely will be given iron and folic acid to be able to boost your blood supply, because we also found that most of our mothers are anemic. Children, definitely we deworm them, and that's because worms also and malnutrition. So if you can prevent malnutrition, then you prevent need for what? Need for blood.
Dr. Dorothy Cheyune also expounded more about the 11th Africa Society for Blood Transfusion Congress, which will take place from 4th to 17th March at Speak Resort Munyonyo.
I expect all those healthcare providers who use our blood and blood products to be at this Congress, because they are going to know why, when they request for blood, why we take some time, what should we do, and how can they help us to improve blood services in their healthcare facilities. So it's a must attend for all healthcare professionals who use our blood and blood products in Uganda.
John Baptist Ahumuza, Church of Uganda Family TV News at 8.